6 vitamins and natural substances to treat acid reflux. Do you suffer from acid reflux or know someone dealing with this uncomfortable condition? In this video, we will explore the causes and symptoms of acid reflux, as well as present natural and effective solutions for relief and prevention. Did you know that an inadequate diet can trigger acid reflux? Which foods can aggravate this condition? Discover how the functioning of the lower esophageal sphincter is crucial for preventing reflux. And more, what lifestyle changes can help control symptoms and improve your quality of life? Stay with us and check out all this essential information. Let's start. Acid reflux. Acid reflux is a common condition characterized by a burning sensation in the chest, known as heartburn. This condition occurs when stomach acid rises up into the esophagus, causing discomfort and pain. Frequent acid reflux is called gastroesophageal reflux disease, GERD, which can seriously affect the quality of life. Symptoms include not only burning in the chest, but also difficulty swallowing, pain when lying down, and in some cases, regurgitation of food or sour liquids. Additionally, it can lead to chronic sore throat and persistent cough. Acid reflux can be triggered by various factors such as inadequate diet, obesity, pregnancy, and even certain medications. Understanding the mechanisms behind this condition is essential for finding effective relief and treatment methods. In the esophagus, there is a valve called the lower esophageal sphincter, LES, which normally prevents acid from rising. When this valve does not function correctly, acid can rise, causing uncomfortable symptoms and potential long-term complications. Functioning of the lower esophageal sphincter, LS. The lower esophageal sphincter, LS, is a muscular valve located at the base of the esophagus, where it connects to the stomach. Its main function is to open to allow food to pass from the esophagus into the stomach, and close immediately after to prevent stomach contents from returning to the esophagus. Under normal conditions, the LES remains closed, creating a barrier that prevents the reflux of acid and other stomach contents. However, when the LES weakens or relaxes inappropriately, it cannot prevent stomach acid from rising into the esophagus, resulting in acid reflux. Various factors can contribute to the malfunction of the LES, including excessive pressure in the stomach due to obesity, pregnancy, or large meals. Certain foods and beverages, such as coffee, alcohol, chocolate, and fatty foods, can also relax the LES. Additionally, smoking and some medications can interfere with the proper functioning of this valve. Understanding the role of the LES and the factors that influence its functioning is crucial for effective management of acid reflux and the implementation of preventive strategies. Signs and symptoms of acid reflux. The signs and symptoms of acid reflux can vary in intensity and frequency, but are generally quite uncomfortable. The most common symptom is heartburn, a painful burning sensation in the chest, usually after meals and worse at night. Another frequent symptom is regurgitation, which is the sensation of bitter acid or food coming back up into the mouth. Additionally, many people with acid reflux experience dysphagia or difficulty swallowing, which can be caused by irritation of the esophagus. Other symptoms include chest pain, which can be so intense that it is often mistaken for a heart attack. Chronic cough, hoarseness, and persistent sore throat are also common, especially in the morning, due to irritation caused by acid during the night. In some cases, acid reflux can cause a sensation of a lump in the throat or increased salivation. These symptoms can worsen when the person lies down or bends over, as these positions facilitate the reflux of acid into the esophagus. Identifying and understanding these symptoms is crucial for seeking appropriate treatment and preventing more serious complications. Causes of acid reflux. Acid reflux is often the result of a combination of factors that weaken or relax the lower esophageal sphincter, LES, allowing stomach acid to return to the esophagus. One of the main causes is an inadequate diet, including excessive consumption of fatty foods, fried foods, chocolate, caffeine, alcohol, and spicy foods. These foods can relax the LES, facilitating reflux. Obesity is another significant factor, as excess weight increases intra-abdominal pressure, forcing stomach contents up into the esophagus. Pregnancy can also cause acid reflux due to the additional pressure of the growing uterus on the stomach, as well as hormonal changes that can relax the LES. Other causes include smoking, which can weaken the LES, and certain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, which can irritate the lining of the esophagus and relax the LES. Stress and lack of sleep are also factors that can contribute, as they affect the digestive system and the production of stomach acid. Additionally, medical conditions such as hiatal hernia can facilitate acid reflux as part of the stomach moves up into the chest through the diaphragm, compromising the function of the LES. Risks and complications of untreated acid reflux. Untreated acid reflux can lead to several serious complications that affect long-term health. One of the most common complications is esophagitis, which is inflammation of the esophagus caused by repeated exposure to stomach acid. Esophagitis can cause pain, difficulty swallowing, and, in severe cases, bleeding. Another significant complication is the formation of esophageal ulcers, which are open sores in the lining of the esophagus. These ulcers can cause severe pain, bleeding, and scarring, which can narrow the esophagus and make swallowing difficult, a condition known as esophageal stricture. Chronic acid reflux can also lead to a condition called Barrett's esophagus, where the lining of the esophagus undergoes cellular changes due to continuous acid exposure. Barrett's esophagus is a precancerous condition that increases the risk of developing esophageal cancer, an aggressive and often fatal form of cancer. In addition to these complications, acid reflux can negatively impact quality of life, causing sleep disturbances, loss of appetite, and constant discomfort. Recognizing and treating acid reflux early is crucial to prevent these serious complications and maintain digestive health. Negative effects of antacid medications. Antacid medications are often used to relieve the symptoms of acid reflux, but their prolonged use can bring significant negative effects. While they provide temporary relief, antacids neutralize the stomach acid necessary for proper digestion of food. This continuous neutralization can lead to a condition known as hypochlorhydria, which is the decrease in stomach acid levels. Hypochlorhydria can compromise digestion and the absorption of essential nutrients such as vitamin B12, iron, calcium, and magnesium, resulting in nutritional deficiencies over time. Additionally, the reduction of stomach acid can increase the risk of gastrointestinal infections, as the acidic environment of the stomach is crucial for killing bacteria and pathogens ingested with food. Another concern is the rebound effect, where stopping antacids can lead to an increase in acid production, worsening acid reflux symptoms. Moreover, some antacids, especially proton pump inhibitors, PPIs, have been associated with an increased risk of bone fractures, kidney disease, and dementia with prolonged use. Therefore, it is essential to address the underlying causes of acid reflux and consider natural alternatives and lifestyle changes instead of relying solely on antacid medications. 6 vitamins and natural substances to treat acid reflux. 1. Melatonin. Melatonin is a hormone naturally produced by the pineal gland in the brain, mainly at night, regulating sleep-wake cycles. Studies suggest that melatonin can help alleviate acid reflux symptoms due to its antioxidant and anti-inflammatory properties. Additionally, melatonin strengthens the function of the lower esophageal sphincter, preventing the reflux of stomach contents into the esophagus. Melatonin supplements can be a useful option for those suffering from acid reflux, especially for those who also face difficulty sleeping due to the condition. 2. Ginger. Ginger is an effective natural remedy for relieving the painful symptoms of acid reflux. Chewing a slice of fresh ginger can provide immediate relief from heartburn due to its anti-inflammatory properties. The phenolic compounds in ginger soothe the tissues of the esophagus and stomach lining, reducing inflammation caused by acid. In addition to consuming it fresh, you can add powdered ginger to your meals or prepare refreshing ginger drinks to help prevent reflux. 3. Betaine HCl. Betaine HCl is one of the best supplements to combat acid reflux at its root. By taking 4 capsules of 1,300 milligrams before meals, betaine HCl helps acidify the stomach pH, promoting more efficient digestion. This, in turn, strengthens the lower esophageal sphincter, LES, making it function properly and preventing reflux. Using betaine HCl for 2-3 days can help restore stomach acidity, with the possibility of adjusting the dosage as needed for better results over a few weeks. 4. Zinc L-carnosine. Zinc L-carnosine is a compound used for decades in Japan to treat stomach ulcers. This supplement is excellent for healing inflammation and damage in the esophagus, stomach, and intestines. It restores the protective mucus barrier in the digestive tract, promoting the healing and repair of tissues. Additionally, zinc generally helps prevent the overgrowth of harmful bacteria, such as H. pylori, in the stomach. Supplementing with 75 mg of zinc L-carnosine daily can be beneficial, as well as including zinc-rich foods in the diet, such as seafood, grass-fed meats, and pumpkin seeds. 5. Probiotics. Probiotics are beneficial bacteria and yeasts that live in the large intestine and aid in digestion. They produce neurotransmitters such as acetylcholine, which regulates the opening and closing of the lower esophageal sphincter, LES. A healthy gut flora, rich in probiotics, can prevent acid reflux and other digestive conditions such as ulcers, gastritis, and IBS. Consuming fermented foods like kimchi, sauerkraut, and kefir regularly helps maintain a healthy microbiome. Liquid probiotic supplements can also be used to quickly reinforce the intestinal microbiota. 6. Apple cider vinegar. Apple cider vinegar is one of the most well-known natural remedies for treating digestive problems, including acid reflux. Mixing a tablespoon of organic, unfiltered apple cider vinegar in a glass of water and drinking it with a straw before meals can balance stomach pH. This improves digestion and prevents reflux. If the throat is very inflamed, apple cider vinegar capsules can be an alternative. The acetic acid in apple cider vinegar also supports colon health, providing energy to cells and aiding nutrient absorption. Lifestyle changes to treat acid reflux. Adopting lifestyle changes is essential for effectively controlling and preventing acid reflux. First, it is crucial to avoid foods that relax the lower esophageal sphincter, LES, and promote reflux, such as caffeine, alcohol, chocolate, fatty, and spicy foods. Replacing these items with healthy foods such as fruits, vegetables, lean proteins, and whole grains can significantly improve symptoms. Another important change is to eat smaller, more frequent meals instead of large meals to avoid overloading the stomach. Additionally, it is advisable not to lie down immediately after eating. Waiting at least 2 to 3 hours before lying down can help prevent reflux. Maintaining a healthy weight is crucial, as excess weight increases abdominal pressure, favoring acid reflux. Regular exercise and a balanced diet are essential for achieving and maintaining a healthy weight. Reducing stress also plays an important role in managing acid reflux, as stress can negatively affect digestion and the function of the LES. Practices such as meditation, yoga, and nature walks can help relieve stress. Finally, elevating the head of the bed can prevent stomach acid from rising during the night, providing a more peaceful, heartburn-free sleep. These lifestyle changes, combined with other natural strategies, can offer lasting relief from acid reflux. Nutritional deficiencies related to acid reflux. Nutritional deficiencies can play a significant role in the development and exacerbation of acid reflux. One of the most common deficiencies associated with reflux is the lack of hydrochloric acid, an essential component of stomach acid. Inadequate levels of stomach acid compromise digestion and the absorption of vital nutrients such as vitamin B12, iron, calcium, and magnesium. Vitamin B12 deficiency is particularly concerning, as this vitamin is crucial for the production of blood cells and the health of the nervous system. Poor absorption of calcium and magnesium can lead to bone and muscle problems, while a lack of iron can cause anemia, resulting in fatigue and weakness. Additionally, potassium and chloride deficiencies can impair hydrochloric acid production, essential for proper digestion. Zinc is also an important mineral that helps heal the lining of the esophagus and stomach. To correct these deficiencies, it is vital to consume a nutrient-rich diet, including foods such as lean meats, fish, eggs, legumes, dark leafy greens, nuts, and seeds. Specific supplements, as directed by a healthcare professional, may also be necessary to restore adequate levels of these essential nutrients. Impact of stress on acid reflux. Stress is a frequently underestimated but significantly impactful factor in the development and worsening of acid reflux. When a person is under stress, the body releases hormones such as cortisol, which can interfere with the normal functioning of the digestive system. One of the effects of cortisol is the relaxation of the lower esophageal sphincter, LES, the valve that prevents stomach acid from rising into the esophagus. This improper relaxation can increase the incidence of acid reflux. Additionally, stress can slow gastric emptying, causing the stomach to take longer to process food, which can result in increased intra-abdominal pressure and, consequently, reflux. Stressed individuals also tend to adopt habits that worsen reflux, such as eating quickly, choosing unhealthy foods, and neglecting regular meals. Stress management practices such as meditation, yoga, regular physical exercise, and deep breathing techniques can be extremely beneficial. Incorporating these practices into the daily routine can help reduce stress levels, promote a healthier digestive system, and reduce episodes of acid reflux. Additionally, seeking psychological support or therapy can be helpful in learning to better manage stress and its physical repercussions. Importance of diet and fermented foods. Diet plays a crucial role in managing acid reflux, and the inclusion of fermented foods can be particularly beneficial. Fermented foods such as kimchi, sauerkraut, kefir, natural yogurt, and kombucha are rich in probiotics, which are beneficial bacteria for gut health. These bacteria help balance the intestinal flora, promoting more efficient digestion and reducing inflammation in the digestive tract. The probiotics present in fermented foods also help strengthen the immune system and improve the function of the lower esophageal sphincter, LES, preventing acid reflux. Additionally, a healthy gut flora can produce neurotransmitters that regulate intestinal motility, avoiding food retention in the stomach and reducing the intra-abdominal pressure that can cause reflux. Besides fermented foods, a balanced diet rich in fiber, vegetables, fresh fruits, lean proteins, and healthy fats is essential for digestive health. Avoiding processed foods, refined sugars, saturated fats, and irritating foods such as caffeine and alcohol can significantly reduce acid reflux symptoms. Adopting a diet that includes fermented foods not only improves digestion, but also promotes overall health, helping to keep acid reflux under control naturally and sustainably. Food and supplement. Suggestions to improve digestion and reduce reflux. Improving digestion and reducing acid reflux can be achieved by incorporating specific foods and supplements into the diet. First, fiber-rich foods like fruits, vegetables, whole grains, and legumes help regulate bowel movements and prevent constipation, which can exacerbate acid reflux. Leafy green vegetables, such as spinach and kale, are especially beneficial due to their nutrient and antioxidant content. Lean proteins, such as fish, chicken, and turkey, are preferable to fatty meats, as they are easier to digest and less likely to cause reflux. Healthy fats found in avocados, nuts, seeds, and olive oil are also important for digestive health and can help reduce inflammation in the gastrointestinal tract. In addition to foods, specific supplements can be helpful. Betaine HCl with pepsin can improve stomach acidity and protein digestion, while probiotics help maintain a healthy balance of intestinal bacteria. Apple cider vinegar consumed in small amounts diluted in water before meals can help balance stomach pH. Other beneficial supplements include glutamine, which helps repair the intestinal lining, and zinc L-carnosine, which promotes the healing of inflamed tissues. Incorporating these foods and supplements into the daily routine can result in more efficient digestion and a significant reduction in acid reflux symptoms. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.